name is Pureza. I'm in Rebecca Diamond's adult self-learning class for FSCJ nursing term 2. Today we're going to be doing an IV medication via minibag. So first thing I'm going to do is check my MAR, make sure that to verify the correct medication for the patient, the dose, the route, and the frequency of the administration that the patient will need. I'll assess any appropriate lab values that the patient has on file right now to let the patient basically know why we're giving the medication and what the action is and any side effects that the patient should incur, so they're prepared for that. Basically what I do is I'm going to take the MAR and I'm going to go into the patient room. I'm going to bring in my IV tubing. I'm going to grab the medication from the drug and check my dates on my little mini bag, the saline. I'm going to grab the medication. I'm going to grab a syringe, a 10cc syringe, one for the medication and one for normal saline to check my line when I go in the patient room. Once I've got all my stuff together, I'm going to go ahead and go into the patient's room, address my patient, get 2 patient identifiers, check the armband. I'm going to scan, or however we're doing it for our hospital protocol to administer medication. I'm going to double check my amount of medication that will be administered to the patient. And basically I'm going to go ahead and wash my hands. There's little slots in here, so it kind of shows you where to open your bag up. Got my bag. It's cardboard garbage. So for this particular patient, they have systemic infections, so the doctor has ordered vancomycin. It's a bacterial cytoaction against organisms in the body. Now I'm going to I'm going to ask my patient, basically let them know what's going on, what their white blood count was, and why the doctor feels this is the best medication for what's going on with the patient. I'm going to draw up 6 mLs of air injected into my bottle, and I'm going to retract my saline, the same amount in saline. Purpose of the video, only having 1 needle. Normally you would throw the needle into the sharps container, safely recap, unloosen this, and then we've got our saline. So the tip is sterile, aseptic technique. I'm going to wash my hands. I'm going to place my gloves on. And when I go into the patient's room, the INT is already done. I'm going to check the site for any redness, heat, swelling. Make sure that everything is good around the skin. There's no bruising, no hematomas, no excess pain to the patient. Once I've checked the site, I'm going to unclamp my clamp here. I'm going to take my saline, and I'm going to do a slow push-stop method. So I'm going to slightly aspirate and make sure that my placement is still in the vein. I'm going to have venous blood return, and then I'm going to slightly push. Half a cc, make sure it goes in. And then I'm going to stop and push a little more. Okay, so I've confirmed that my line is still good. It's still correctly placed, so there's no danger in infiltrating the arm of the patient, which is very important. After I've done that, I'm going to calculate my dosage. We're going to be doing vancomycin over 6 hours. Basically, 500 milligrams over 6 hours with a 10-drop set. We're going to calculate 14 drops a minute. So it will infuse for 6 hours. Okay, so I'm going to place a needle. my syringe, and then I'm going to draw up my vancomycin.
Hello?
So you want to inject the amount of air that you need.
Yeah, it had like a attachment to it. They need a timer drop on it. Okay. Alright.
Now that we've got the medication drawn out, we're going to recap this now, which we wouldn't normally do, but we only have one. So, on the medication bag, we have, where's my label? Red label. Okay. Well, we're basically going to, initially, we're going to put not the amount of saline that we have, but the actual dosage of the drugs. So we're going to put that we have 500 milligrams on our label. So we're going to put the total dosage, 500 milligrams, vancomycin. We're going to put the date and the time that we're going to administer, that we're going to begin our IV. Our initials. Now, you'll notice that the bag has two ports. This one is to connect to our IV tubing, the one with the blue, and then this one is our needleless, our needle port to inject any medication. So very carefully, you're going to take your medication and you're going to hold from here and inject the medication. Now I try to hold the bag firmly so it keeps the valve straight, so that you ensure that you're not going to poke through your medication bag, because it costs a lot of money if you were to poke through it, and then you got to start all over again. So once the medication is in here, there is no shaking. You're going to slightly invert. Now once you've done that, we're going to take the IV line. You'll notice there's a roller clamp and there's a smaller clamp. I'm going to move these up to my first port. I'm going to undo the roller clamp all the way, and we're going to bring this all the way to the bottom. Okay, just like such. Basically, you don't want to lose any medication. We're going to take this off, which basically keeps our tip sterile until we're ready to put it in here. When you're ready, you take this off, and then you do a slight twisting motion and you connect the two. Once it's fully inserted, we're going to fill the chamber halfway. I'm going to slowly open this. And you're going to see the drip come through. Okay. Once you're good to go, there's no air in the line. We're going to take the needleless port and we're going to connect it to the patient. Now, if this is not sterile, you're going to want to take an alcohol swab and clean your port before you connect. This one, however, It's brand new out of the package. Do not touch the tip. If you do, clean it. Take it, you're going to push against it, and it's going to go clockwise and be secure. I'm going to take a piece of tape and secure this right above so that the line stays straight and it does not become occluded. Now I'm going to dispose of any needles that I have in a proper sharp container. Now I'm going to take this and I'm going to document my tubing as well. I'm going to put the date, the time, the initials, my initials, and the time that we started using this. And then we're basically going to leave that. So we're going to record the time, the drug use. Okay, and now if we need heparin, we have to make sure that, you know, it's ordered, and we would flush the line into a PICC line. If we're going into a PICC line, we would use heparin. Make sure to keep that line from clogging, from the blood from clotting. But that's directly if you have an order written. If not, then that's something we're not going to use for the regular mini bag to INT and arm. And this is basically our Via mini bag.